prioritization, and delegation. How do you answer question? Read the question from the back. Try as much as possible to take your time, read the question from the back, and find the buzzwords. I'm going to underline the buzzword. At every question, I'm going to show you the keywords you're supposed to focus on. Which client is most appropriate assignment for the nurse? Which nurse? A nurse from the labor and delivery unit is floated to the medical surgical unit. Underline labor and delivery floated to medical surgical unit. So those are our keywords we're going to focus on. I'm going to focus on those information, and I'm going to put the check mark here, and check mark. Those are the one we're going to focus on. A client with what? Chest pain awaiting cardiac catheterization. A client 2 days post cholecystectomy ready for discharge. A client with what? Type 2 diabetes who need assistance with ambulation and glucose monitoring. 4, a client in sickle cell crisis requiring frequent IV opioid administration and what? Closed monitoring. What is the best way to answer prioritization question? I want you to divide the question answer choice into 2. Find the key information. Chest pain. What am I going to do? Cardiac catheterization. Post cholecystectomy, I need discharge. Type 2 diabetes, I need to walk and get my glucose check. I'm in sickle cell crisis, I need opioid administration frequently. Those are the things you're going to focus on. Now, what is the concept to answer question regarding floatiness? You have to pay attention. They should not get anybody who's getting discharged. They should not get anybody who's having new information or is a new admission or specialized information for the unit. The unit is med-surg. Cardiac catheterization is a specific to the unit, right? And patient requiring IV fluid and a patient requiring IV opioid and close monitoring is specific to the unit. Therefore, the only person who's safe and stable for floatiness is a patient who just needs glucose monitoring. This is the way you should approach each question. And therefore, the right answer is number 3. This is the patient, we're going to give it to that patient. Number 2, this is a prioritization. A nurse is aware of 4 pediatric clients. There's 4 pediatric clients in the emergency room. Which client should the nurse assess first? Same thing. Divide the question into 2, and I will guide you. I will guide you every question, what you need to focus on. Stop the video, answer it on your own so that you can keep track of your score. Divide the question into 2 and say, age is not a factor. So 4-year-old, 10-month-old, 6-month-old, ignore it. Go for the buzzword. The 4-year-old with the fever of that, what? After flu vaccine. Is this what you expected? The 4-year-old fell down the stairs with what? Forehead laceration and a nasal discharge. Is this what you expected? A 10-month-old with what? Projectile vomiting, crying, scaphoid abdomen. And a 6-month-old with the painless, this is a buzzword, scrotal swelling that trans-illuminate and there's no distress. Expected finding. If you want prioritizing strategy, check my YouTube channel. There's a bunch of video on B-sharp. That means you got to worry about breathing, electrolyte, shock, sepsis, airway, and pain related to that patient. A has a fever, but it's not sepsis. It's an expected finding when I give you flu vaccine, eliminated. The second one, I fell, I have laceration. If you fall, you're going to have laceration. But what? Nasal discharge, I don't expect this. If you have projectile vomiting, crying, and scaphoid abdomen, and you are 10-month-old, you have pylori stenosis, an expected finding. If you have painless scrotal swelling, that means it's not painful, it's just swelling. And the trans-eliminate, that means there's fluid in it. And that is hydrocele, expected finding. Therefore, what do you think is the right answer? Patient who had laceration and there is clear nasal discharge. This is what we call CSF leak. This patient may have basal skull fracture, and therefore we have to pick this guy. He's in trouble. That's our prioritization. And you're getting the strategy now. This is number 2. These are questions from my Q bank, adapt and lesson to go across all most important topics you should be aware of. It's just concept. I'm not saying these questions are going to show up, but this is the concept. So write down the concept. Same thing. Which assignment is most appropriate for a new graduate? The word is assignment. Underlying in the question. The charge nurse is making assignment for a staff of what? RN, LPN, and a new graduate. 3 nurses. Who are you going to give to the new graduate? A new graduate is treated like somebody who is a newbie, just came to the hospital. Even though you're a nurse, we're going to give you certain patients. Who do you think? Somebody, new chest pain, awaiting cardiac catheterization. Somebody with amyotrophic lateral sclerosis with dysarthria. Somebody with what? Pulmonary embolism who is being started on what? IV heparin protocol therapy. If you're in that situation, taking the NCLEX, which answer you want to pick? Stop the video, put down your answer, and think about it. But this is what I can tell you. You should not give them any patient who is unstable. New chest pain and cardiac catheterization is a bad problem. They cannot have it. 24-hour appendectomy, and I'm eating clear liquid diet. It look like I'm stable. ALS patient with dysarthria. This is airway problem. Write it down. Pulmonary embolism, heparin protocol is complicated. They cannot have it. Therefore, the patient they're going to see is assigned to the new graduate is number 2. So this is the right answer. And nurses are aware of 4 clients. And so what? Who should be seen first? Okay, a client with a client with AAA, aortic abdominal aneurysm, will report what? Sudden back pain. Should I worry about that patient? If I have 4 patients, is that my concern? I'm underlying the buzzword. I have osteoarthritis. What am I doing? Knee pain and walking. Read the question like that so that it makes sense. It's not abstract. I have COPD. And so what? I report dyspnea on exertion. Okay, should I worry about it? I have multiple sclerosis and have what? Chronic fatigue. Then you write your B sharp. And you say, is there any breathing issue here? I see a COPD patient is having dyspnea. Should I expect that? I see what? Electrolyte issue. I don't see that. Sepsis, nobody have sepsis, but you go through that, right? And then you manage it. AAA, who has reported back pain. I think this patient is bleeding. That's what? Rupture. Osteoarthritis, I have pain. If this pain is not going to kill me, I'm not going to lose my life, I'm not going to worry about it. But when do they have pain? When they walk, expected finding. Multiple sclerosis, you have chronic fatigue. I expect that. Therefore, what do you think? This guy is in trouble, he's in shock, he's bleeding. Number 5, and nurse is caring for 4 clients, GI client, they have GI problem. What is going on with them? A client with pancreatitis with elevated amylase, a client with colostomy with a small bowel obstruction with distension, a client who just had cholecystectomy with shoulder pain, a client with gastroesophageal reflux who report what? Heartburn after meal. Once again, the way to answer prioritization is to make it your own. And then you divide it into 2 and you say, what? What am I worried about? I'm going to pay attention to some key stuff. A client with pancreatitis, I put a mark there. He has what? Amylase elevated. I have colostomy and I have small bowel obstruction. Cholecystectomy and I have what? Shoulder pain. I have reflux and I have heartburn. Which of this is an expected finding? You can see that this is an expected finding. Eliminated. Colostomy, you have obstruction and distension is not expected. Cholecystectomy and you have shoulder pain is an expected finding. If you have reflux when you eat, you're going to have heartburn. Who are you going to pick? I know you get the right answer. This is our patient that need ferrocare. This is a problem. Small bowel obstruction. It can risk perforation. And this is assessing for maternity client. This is maternity. I did a lot of video series you should watch. It will help you master maternity. I will link some to this video. But what is the problem? A pregnant client at 3 weeks, he has a headache. A postpartum client with the firm fundus at the umbilicus. Patient is in labor, there's early deceleration, and a 2 days postpartum with a light lochia rubor. Divide it into two. Find which one you worry. If you worry, then you pick it, but you got to be sharp. When you pick the answer, that means not an expected finding, but something that has breathing, electrolyte, shock, sepsis, airway. That's how you do prioritization. What do you think? 3 weeks old, headache. What do you think? 3 weeks pregnant, headache is not good. First trimester headache is not good, right? And it's severe. Adjective qualifying it. Postpartum client with firm fundus at the what? Umbilicus, unexpected finding. Client is laboring, early deceleration is what? The problem, right? 2 weeks postpartum, 2 days postpartum with light lochia, unexpected finding. I have headache and I have early deceleration. You know, early deceleration is head compression. Therefore, don't pick it. Pick the one that shows you know how to do prioritization. And that is number one. For renal client, which renal client should the nurse assess first? Same thing. Go for the buzzword and underline it, and then think about what is going on. Connect the keywords in the question. I call it buzzword to answer the question. A client with what? Nephrolithiasis, and so what? Frank pain. Okay. Client with glomerulonephritis, and so what? I have periorbital edema. Okay, check. A client with what? Enoxaparin, I have what? A client on enoxaparin, I have what? Flank pain and bruising. Okay. A client with nephrotic syndrome, I have what? Proteinuria. What do you think? Nephrolithiasis is what we call what? Kidney stone. Kidney stone is an unexpected finding. You're going to have frank pain. I'm not going to worry about it. Glomerulonephritis, your kidney is in trouble. That means it's going to retain fluid. You're going to have periorbital edema. If you take enoxaparin, which is anticoagulant, and you have frank pain and bruising, what do you think? You're bleeding. What kind of bleeding? Retroperitoneal bleeding. Well, are you going to see it in the periumbilical area and in the frank area? What do you call this? This is what we call gray Turner sign. This patient is in trouble. Nephrotic syndrome is the same thing. Kidney is injured. You're going to lose protein, and therefore I see a bunch of what? Protein in your urine. So which one is our right answer? Pick it, this one. This is the way I want you to approach all of them like that. If you approach them like that, you can see that prioritization is easy. Now, same thing, assignment, patience, relax. There's a buzzword there. Don't let it trap you. And this is assigning clients to an experienced LPN. Buzzword, experienced LPN. If you take it the NCLEX and you see this word, ignore it. Just because you're experienced does not mean your scope of practice changes. You're still an LPN. What you do, we call it MMR most. I'm giving you the concept. You should write it down. MMR most. That means what can you do? You monitor most medications. That means not all, but most. You can do what? You can administer them. You can reinforce teaching. You can do stomach care. You can do tube feed. Those are the classified and special tests. Use that information to answer questions regarding what? LPN assignment. Therefore, a client with COPD who need scheduled inhaler, what do you think? A client 2 hours post mastectomy requiring initial wound assessment. A client with what? Diabetes who needs routine insulin administration and blood glucose check. A client with new onset of what? Confusion, fever requiring IV antibiotic. Client on warfarin therapy who need education about dietary vitamin. A client with what? Stable hypertension who require reinforcement. I give you the keywords. MMR most, right? And then you go for those adjectives. You look if the patient does not need anything that require initial assessment and teaching, as the LPN would do. Therefore, based on that, I see COPD, they need some medication. Most medication, they can do that. I see a 2-hour post-surgery. The word initial is negative. I'm not picking you. Diabetes patient, just say insulin administration. I'm picking you. New onset, I need an assessment. You're not picking me. I have warfarin who need education about what? Dietary. There's education there. No, they can reinforce it, but not initial education. You see, that's the way you should be thinking about each question. Think like that. Client with what? Stable hypertension who require reinforcement of what? Medication adherence. What do you think? Which answer choice will you pick? I've given you the clue that you can use to answer the questions. You can see that who should be assigned to an experienced what? LPN. The first person we're going to pick is what? Stable patient getting inhaler. Initial, negative. Diabetes patient, just monitoring. A new, I'm ignoring it. Therapy, education, not reinforcement, I'm ignoring it. And somebody who has hypertension, I'm giving it to him. This is what LPN can do. ACF is the right answer. Endocrine question. You can have endocrine prioritization. A client on metformin, what is the problem? Dark urine, muscle pain. A client with what? Hypothyroidism has what? Confusion. A client with diabetes insipidus, excessive urine output. A client with what? Type 2 diabetes with the fasting glucose of 140. All these prioritization questions are created is to test your knowledge about content related and the concept. And class will take this information and put meat around it and create their own question and use different language, but it's the same thing. Therefore, if you see this divided into two, ask yourself, what do I expect? Metformin. I have dark urine, muscle pain. This is what we call lactic acidosis. Hypothyroidism and confusion. I have mesothelioma, coma. Write it down. Diabetes insipidus, you're going to have excessive urine output, dehydration. Type 2 diabetes, your fasting glucose is not going to be normal, 140. Therefore, what do you think? Who are you going to pick? You know this is unexpected. You know this is unexpected. Now you're left with what? Metformin, dark urine, and muscle pain. Lactic acidosis is expected, but it's bad problem. But when you have hypothyroidism and you're confused, mesothelioma coma, you have to be in an ICU. It's bad. It's a bad problem. So mesothelioma coma should be our prioritization.